The stress of providing care in less ideal situations often interferes with civil communication. This exchange between the nurse and the physician shows how both providers are impacted by the late arrival of laboratory values. Many nurses can relate to the following situation, and many physicians will also relate to the doctor's comment, "Where are the nurses?" Note that the nurse follows the hospital policy related to accessing information only for the patients assigned to her. The physician is not aware of this policy and continues to challenge the nurse to obtain the lab values for other patients. The physician relates the stress of the surgical site infections and notes how the nurse responds, bringing back the situation to the patient's well-being. All healthcare providers experience less than civil communication, often on a regular basis. Patients and their families may contribute to stress, leaving nurses and physicians with limited resources to discuss underlying causes of anger. The emphasis on outcomes may make patients as well as healthcare providers feel that they're being pushed and have little control over the healthcare experience. This situation does not give a happy ending, and it offers the challenge of what can be done to prevent the situation shall it come up in the future. The nurse gives some ideas of how to prevent such a situation in the future.
Hey, you. Where are my INR results for the report on Margaret Jones?
Oh, Dr. Green, luckily I'm the nurse assigned to take care of your patient. The lab tech came up late, and they should be showing up on the EMR shortly.
I have patients to see and surgery in an hour. I don't have time to wait around for 10 minutes for results that should have been here already. Can't you get anything right around here?
I will call and find out the results for you.
Well, while you're doing that, get the INRs for my other patients. One should have a blood culture that's ready as well.
I'm only taking care of one of your patients. I will call the unit secretary and find those nurses for you stat. Hi, this is Maya. Dr. Green is making rounds on his patients and needs the lab results back. Can you have the patients on his nurses? Can you have the nurses on his patients report to the nurses station? Thank you.
I specifically told you to do that. Are you being insubordinate? I need the results for Juan Martinez and David Dahl right now. You were already on the phone with the lab. Just ask them.
I cannot do that. It is a breach of hospital policy, and I'm not being insubordinate to you. I'm simply following hospital policy. I can call the unit manager, and she will be able to get the results of any patient.
But I already ordered you to do that. That should have taken care of it.
I can dial the lab on the phone, hand the phone to you, and the lab will be able to give you the results of any patient.
Look, all I'm asking is that nurses be able to talk about their patients. Instead, all you've given me is attitude, and the nursing station is vacant. Where is everybody? On a coffee break?
Our unit secretary is covering 2 units today, and she's in the other unit. The other nurses are providing patient care. I happened to come back to the desk to see if the other patient's family had arrived.
All I'm hearing is about how short-staffed you are. Your staffing issues are not my problems to solve. I need my patients' reports, and I need them now. Do you hear me?
This is Maya on ortho. Are the INR results available for Miss Margaret Jones on room 712? Okay. Okay, please call me as soon as they are available. Thank you so much.
What? They're not ready yet? My time is valuable.
I understand. While we're waiting, I can come with you to visit Mrs. Jones. She's concerned about some swelling in her knee.
Swelling. She just had surgery. What does she expect?
I think that if you tell her that swelling is normal, she will be much less anxious. Sometimes it's better to hear from your doctor that there might be swelling even if she told you before. She just wants to make sure everything is in order before she gets to go home. Do you think she will be able to get discharged today?
Oh, I don't know. Because I don't have the INRs, which you still don't have.
The nurse taking care of Juan Martinez texted and said she saw some redness around the incisions and wanted you to take a look at it.
Great. So now I suppose I have a surgical site infection count against me. Don't you nurses know how to properly change a dressing? And infection counts against the hospital too. I would think you would care about how to do your job well enough to know how to do it. If this is an infection, we are all going to suffer.
Yes, I believe we will all suffer, including the patient, but I also believe that every nurse on this unit is competent in dressing changes.
If this was my clinic, you would all be fired by now, starting with you.
I understand clinical nursing and hospital nursing are very different. I understand that if the nurse is readily available, that is more efficient for you. I can voice this in the next unit meeting. Perhaps we can facilitate a more efficient nurse-physician rounding. Would you like to make rounds on Juan Martinez first? I think the INR results should be available by
What's
then.
your name? I'm reporting you to the chief of medicine. You have done nothing to help me today, and I am done with your incessant insubordination.
My name is Maya. If you're unhappy with the nursing care, I will call the nursing supervisor who will also deal with your report. The nursing supervisor is on his way.
He can come find me. I have real work to do.
Number 1, how would you handle this type of confrontation? Number 2, how did the nurse clarify the difference between nurses who work in the clinic and those who provide care in the hospital? Number 3, the nurse suggests an idea for planned rounding with the physicians. How would you introduce this idea? How would a practice council evaluate if planned rounding with physicians is successful related to the length of stay and outcomes?